I'm centering myself. So I'm reviewing my patient's chart. I see that we have Aiko. You are a 25-year-old female.
31.
Wow. Okay, 31-year-old female. So I reviewed the chart. I'm ensuring privacy. And I've grabbed all the equipment that I need. So for this one, I need my pen light. So I walk into the patient's room. I'm assessing the situation. So not agitated. There's no distress. There's no PPE risk or any isolation precautions required. She's alert and orientated, calm, cooperative behavior. So I'm walking into my patient's room. So hi, Aiko. My name is Nicole, and I'll be taking care of you today. Hi. So what brings you in today?
I'm having headache.
A headache. Okay. Can I just get your last name, please? And I'm looking at the armband and then your date of birth, which we won't go through. Okay, so headache. Is there any other issues other than for the headache?
That's it.
Okay. So today we're going to be doing a neurological assessment. So I'll be asking you quite a few questions actually. And then I'm actually going to do a couple of different tests to test for coordination and balance as well. So in total it should take about 10 minutes. During that time, I'm also going to be writing some things down. It's meant to go into your patient's chart, so everything will remain confidential that way. So the doctor will be able to see it and anybody else who's within your circle of care. Do you have any questions for me? No? Can I begin?
Sure.
Okay, awesome. So I'm going to ask you some other questions. So do you have any history of seizures?
No.
No? Any head injuries in the past or any that you have known of?
No.
Fallen, hit your head?
I don't.
Okay. Any dizziness or vertigo?
I think I do have sometimes.
Sometimes? Okay, so we can chat about that one later. And any numbness or tingling?
No.
No. Okay, so now we're moving on, focused on the headache. So I'm not going to get you to answer any of these questions, but when did the headache start? What makes it worse? What makes it better? Describe to me this headache. How does it feel? Can you point to me of where your headache is? And does it spread anywhere? On a scale of 0 to 10, 0 being no pain at all, to 10 being the worst pain imaginable, how would you rate your headache? Does it come and go? Does it happen at any particular time of the day? And what do you think might be the cause of this headache?
No idea.
No idea. Okay, so I went through all my OP cares to you. So now I am doing an inspection, neurological assessment. So looking at appearance, so I see that there's good facial symmetry, no facial drooping, no ptosis, so no drooping of the eyelids as well, and there's no deviated gaze or anything like that. In terms of behavior, my patient is calm and cooperative. I don't see any obvious paralysis or any obvious weakness in their limbs, and there's no tremors or tics. So moving on into my Glasgow Coma scale, so I see that my patient is spontaneously opening and blinking their eyes and making eye contact, which is great. In terms of best verbal response, so you told me your name, which is great. Can you just tell me where we are?
Georgian College Hospital.
Awesome, good. And what month are we in?
October.
And of what year?
2022.
Good. So my patient is alert and orientated ×3. So we've got the best verbal response would be a 5 points. And in terms of motor response, I'll just get you to bring your arms up for me and bring them down and maybe just look from side to side. Great. So they're obeying a 2-part command or 2-part request. So they're following commands. So my GCS score would be a score of 15. I'm just going to take a look at your pupils or your eyes. So what I'll get you to do is just take a look at me and don't pay attention to the light, okay? I will be flashing a light in your eye just for a short period of time. Okay? And it doesn't work. So in this case, I'm looking at their pupils. So I'm looking to make sure that they're both equal. So right now, there are 3. They're equal bilaterally and they are round. So now I'm going to flash a light in your eye. It's really not bright. So I'm starting from one side, going to over here, Good. No, it's not working.
Okay.
There's nothing working in here. No. Okay, so I flash a light in the eye. I see that it's constricting. Go all the way around. Flash another light here and are constricting. So then I have Pearl 3+ because of a brisk response. Okay, I'm assessing now for muscle wasting. So I'm just going to be palpating your hands, your arms, little massage, and just going down over here as well. Okay, and there's no obvious muscle wasting, any asymmetry between one leg to the other, one limb to the other, which is a normal finding. I'm also just going to ask you to squeeze my hands as hard as possible. Good, and I'm even going to try to pull back a little bit, and there's some good grips. For leg strength, we'll do the gas pedal one. So here, I'll just get you to press on my hands against my resistance. Good. And over on the other side. Good job. So I've got a good, strong bilateral upper and lower extremities strength. Okay. Now I will get you to do a few different tasks. Like, bring this down a little bit. So the first task is to test your fine motor skills. So what I'll get you to do is I'm going to get you to touch every finger to your thumb together, and I'll get you to do it gradually faster and faster. Good. And the next one is I'll just get you to sit over onto the edge of the bed. Okay. And here I will get you to tap onto your legs, front and the back of your hands, and then gradually again going faster and faster. So this is rapid alternating movements, again just assessing for coordination. Good. So the next one, if you're not too dizzy, you can stand up for me. This one is called the tandem walk. So with this one, I will get you to walk to that side of the bed and hold on, heel to toe. So your heel has to touch your toe while you are doing it. There you go. Assessing for balance. Good. And you can stop right there. You can come over this way. And then I'll just get you to put your feet together for me. Together. You just have to touch. Yeah, good. Hands to the side, and I'll just get you to close your eyes. And here again, I'm just assessing for balance. Good, thank you. So now for my S-bar. So, hi, Mr. Smith. My name is Nicole. I'm calling from Georgian College Hospital. I'm calling about your patient, Aiko, 31-year-old female. 31-year-old female complaining of a mild headache. Currently she's in Georgian College Hospital, room 105, bed 1. So she was admitted yesterday, and her admitting diagnosis is the mild headache. There's no relevant blood work or test that has been done up to date. In terms of my assessment, Pearl 3+, which is within normal range, a Glasgow Coma scale of 15. I'll just throw in one more finding as well, so negative Romberg test. I recommend that you come and assess her, as I think that she would be fit to go home at this time. Yeah. Okay.